Okay. Good morning, my name's Ailey Fletcher. I'm an analyst in Public Health Scotland, and this morning I'm going to talk about forecasting the extent of future public health challenges using the Scottish Burden of Disease study. So just a bit of background about the Scottish Burden of Disease study. So the global burden of disease produced estimates annually for Scotland, national level, and it was felt that within Scotland, local estimates were needed to inform local decision making. So in 2013, the Scottish Burden of Disease study was launched, and through this, we produced estimates of burden for 132 diseases and conditions. We produced these nationally and also at deprivation decile level, and subnationally, we produced them at a range of geographies. So just some of the results from our most recent Burden of Disease study, which was 2016. So the chart here shows the total burden in disability adjusted life years ranked by the 25 diseases which contribute the highest burden to Scotland. So we can quite clearly see that the top 5 diseases actually account for over a quarter of the total burden. And in that we have ischemic heart disease, lung cancer, stroke, so conditions which historically have had a high mortality rate in Scotland. But we also have low back and neck pain and depression, which are 2 conditions which don't actually have a fatal component. And I previously said we also produce estimates at deprivation decile. Using these, we were able to estimate that around a third of our total burden of early deaths and ill health could theoretically be prevented if we all had the same life circumstances as the people that live in our least deprived areas in Scotland. So this just illustrates one of the challenges affecting Scotland, which is health inequalities. And similar to a lot of other countries across the world, we're also seeing stalling life expectancy and an increase in our ageing population. So these are some of the reasons why we want to project the burden of disease. We want to provide our policymakers and service planners with a robust evidence base in which they can base their future decisions. And in the current climate, we're also hoping that these projections of burden of disease provide a best guess estimate of what a non-COVID world would look like. So our data sources and methods, to enable us to estimate the future burden, we first need to project the prevalence, incidence and mortality for our diseases. So we generated counts of these metrics from 2000 to 2019 as our base data. And to do this, we used some of the high quality patient level linkable health data that we have available in Scotland, some of which is illustrated on the right. And we also used population estimates and population projections from the National Records of Scotland. So to project these metrics, we fitted age, period, cohort models to our historic data. We fitted a range of models and selected the best fit model for each sex and disease grouping. And from these, we were then able to produce sex-specific projections of prevalence, incidence, and mortality for our diseases. We then used these projections to estimate the future burden. So our projections of prevalence were combined with severity distributions and disability weights to determine the future years lived with disability. And our projected mortality was combined with life tables to determine our future years of life lost. So some results. Currently, we have full mortality projections available for our 132 diseases, causes of disease, and morbidity projections available for groups of diseases such as cancers, cardiovascular diseases, respiratory and others. So the results shown here are for cerebrovascular disease. On the left, we have our mortality projections. So the bars are deaths and the hatched lines are years of life lost. On the right, we have our morbidity projections. The bars are prevalence and the hatched lines are years lived with disability. And we can quite clearly see on the left that we are projecting that deaths and then years of life lost are going to decrease across both sexes for cerebrovascular disease. On the right, we're seeing that we're projecting the prevalence and years lived with disability are going to increase. And this is quite interesting. This is a common theme seen across a lot of our projections, that whilst our mortality is projected to decrease, it means that people are going to be living longer in ill health. And this can be illustrated by these charts here, looking at the ratio of years of life lost to years lived with disability for our total burden. And we can see that in 2015 to 17, around about a quarter of our burden for cerebrovascular disease came from years lived with disability. Actually, in the future, we're projecting that this will be over half the total burden. And as I said, these results are indicative of a lot of the results that we have seen The exception to this are what we might term the social causes. So, for example, drug-related deaths and deaths from alcohol use, and diseases primarily affecting the elderly population. And in that, we are projecting that the mortality is going to increase. So what are our next steps? Well, as I said, we want to do these projections to provide an evidence base for planners and policymakers. And we're hoping to focus on modifiable risk factors, to use population attributable fractions to estimate how changes in these risk factors may affect our future burden. And we're going to build in some scenario planning to that. But ultimately, we want to know how can we stop these DALYs that we're projecting becoming a reality. So which interventions could give us the best return for these? And finally, dissemination, which is very important to us. We want to make sure that these projections are used by the people that need them and want to use them. So that means engagement with decision makers at all levels. So, for example, policymakers at governmental level, but public health practitioners on the ground as well. So I've just left some contact details there and where you can find more information about the Scottish burden of disease. So please get in touch if you have more information or questions you'd like to ask. Thank you.